Hi, and welcome back to the Elder Watch web series, Long-Term Care Planning. Today we'll be getting into some of the considerations and questions you might want to ask before you decide on a long-term care facility. My name is Jessica Zawadski. Thanks for joining us, and let's get started. This presentation is brought to you by Elder Watch Colorado, a 20-plus year partnership between AARP and the Colorado Attorney General's Office. We fight the financial exploitation of older Coloradans through education and outreach, data collection, and through our volunteer-run helpline. If you or someone you know may be the victim of fraud or a scam, give us a call. Our phone number is 800-222-4444. Select option 2. In this series on long-term planning brought to you by ElderWatch, we'll be covering 4 topics that relate to long-term care planning. Last time, we talked about some of the options and acronyms. So what are different types of long-term care facilities? Who are they best suited for? And what are all of these acronyms? What is all this jargon that you might encounter? So if that's a question you have, go back a couple videos back. We've got 2 videos answering those questions. Today, we'll talk about some of the considerations that it's important to think about when you are looking into long-term care facilities, as well as helping you to compare one to the other because they are unfortunately not all made equal. In our third topic, we'll be talking about what insurance does and does not cover and kind of how that works depending on what level of care you or your loved one needs. And then in our final topic, we'll be talking about some ideas, strategies for how to pay for those things that insurance doesn't cover, because as you'll learn next time, there's a lot, and you might be surprised by what those out-of-pocket costs might be. So if I had a word cloud of all the words I say, I feel like not exhaustive would be one of them, because just like in all of our other presentations, at least for this topic, the list that I'm providing is not an exhaustive list. There are definitely other things that you'll want to consider and ask depending on your particular situation. Think of this presentation as more of a jumping off point. I want to plant these seeds so that you start thinking about these things, particularly if you are starting to look at different care facilities. So today, for our considerations and questions to ask, we'll start with the things that you should think about and or look into before you even get to the facility. So this might mean things you want to look into online, things you might want to ask someone over the phone before you physically go tour a facility, because some of them might be red flags or deal breakers, and it's important to have that information before you get to the place that you're going to tour, because our time is valuable, and you'll see there's a lot of things to consider, and there are many different options for care. So if you can kind of narrow down your list by asking some of these questions before you even get to the process of touring, it's going to save you some time. So first, we'll cover those. Next, we'll talk a little bit about questions you want to ask about what is and is not included in your cost of stay. You might be surprised by some of the things that are not always included. Third, we'll talk about some staff considerations, questions you'll want to ask, things you'll want to consider when you learn about who is staffing a particular location. After that, we'll talk about health and safety considerations. Fifth, we'll talk about trusting your gut and really using your senses while you are visiting a long-term care facility. And then lastly, second to lastly, we'll talk about some other considerations that you'll want to think about and ask. And then we'll wrap things up with 2 resources that might help you in this journey. So we'll be talking about placement agencies as well as the Area Agency on Aging. Let's get started. All right, so as I mentioned previously, this process of viewing places, finding places, getting all of the information can take a long time and honestly be kind of overwhelming. So if you can narrow down the list of locations that you're considering before you start that process, it might be really helpful in terms of opportunity cost and honestly, your sanity. So the first thing that you might want to look into before you arrive at a facility is reports of abuse and neglect. And of course, this might not be something that you feel comfortable asking when you physically get to a location, but it might also not be something that the person you're touring with really has a good grasp on. So if you come into the situation knowing about pending or past allegations of abuse and neglect, this might be helpful for you in deciding whether a location is a good fit or maybe you want to find something else. Another thing that might be helpful to know about before you visit a location is what options do you or your loved one have if you decide that the location you've chosen isn't a good fit. If you terminate a stay, what's the policy? How much notice must be given and at what point? So, for example, if you decide that it's not a good fit within a week, is that different than if you decide that it's not a good fit within 6 months? Kind of similar to this topic is knowing when you or your loved one might have to leave a facility. And by this, I mean, what is the highest level of care? So, for example, if you are going to be going into an assisted living facility, at what point will you max out the care available to you there? How much are they able to help with ADLs? If there is some early onset dementia, at what point will the services there no longer be able to adequately care for you or your loved one? Knowing this threshold is the word I'll call it, can be really helpful, particularly depending on the reasons why you or your loved one are choosing to move into assisted living. And the last thing that, well, not the last thing, but the last thing on this slide that is important to know about before you get to a location is about Medicaid beds. So we'll talk about this in our insurance coverage portion, but not all not all long-term care facilities will have Medicaid beds. And so generally what this means is if your assets or your income gets to a certain point where you do qualify for Medicaid, will you be able to switch over to having Medicaid pay for your stay? Because again, this is not something that every location has. So if that ends up being part of your strategy for paying for your long-term care, it's very important to know whether the facility has Medicaid beds before you get there, because otherwise, unfortunately, you might have to leave if that's part of your plan. So we're not going to delve all the way into cost in this presentation or on this slide, because our next two topics after this will be about costs. But cost is a really big factor when it comes to long-term care planning. So on these slides that you'll see, in the top table, you can see a comparison between different types of services. And in the bottom, you can see how nursing home costs specifically, so only nursing homes, not long-term care, not assisted living, vary across Colorado and compared to nationwide averages. And I'm just pulling this up because I think it's important to see those differences in what costs look like, but also so that you have a little bit of a ballpark. Knowing the cost of a location before you get there, in addition to knowing whether they have those Medicaid beds or not and how your insurance might come into play, can be really helpful in helping you to decide on a location that best fits you or your loved one's needs. So from here on out, the slides that we're talking about are things that you can ask and find out before you get to a physical location. But I think the following slides might be a little bit easier and or give you more information when you have the context of being in a physical location. So the first thing I want to talk about is what's included in your cost of stay, but more importantly, what's not included, because you might be surprised by some of the things that either are not included or that incur an additional cost. And sometimes they'll just show up on a bill. You didn't even realize that you were incurring this additional cost. Now, like I said, one of my favorite words, this list is not exhaustive or it's not fully comprehensive. There are definitely more things that may or may not be included in your cost of stay, but I thought it was important to kind of list some of the things that might not be included depending on the location, because I personally was surprised. So some of these things might be medication management, incontinence help and supplies, activities and outings, internet. There's a bunch of things that might not be included. And I'm using the word might because some facilities may have them included in the cost of stay, whereas for others, they may be a la carte and things that just get added on. So if you or your loved one needs something in particular, for example, the incontinence support, You want to know if you're going to have to pay for that out of pocket, if you're going to be able to use some other type of funding, or if it's included in your cost of stay. Sometimes locations will also have different tiers that have different inclusions and exclusions based on the tier that you decide to come into. So being on site is a great place to understand what is and is not included, because you'll get to see what that facility looks like and kind of get a taste of what those inclusions and exclusions might actually look like. A very important piece of deciding on a long-term care facility is staff, because staff can really make or break your stay. And so one of the first things I want to talk about when it comes to staff is the caregiver ratio. And all this means is how many patients per each individual caregiver. And this can be important. It might be more important if, say, you're in a higher need facility like a nursing home. It might be less important if you're in a lower need facility like independent living. But caregiver ratio, like I said, is just how many patients are on each caregiver's caseload. And the reason that this is important is because, for example, if you're looking at a nursing home and each staff member has a caseload of 25 individuals, it might mean something different for the level of care, the attention to detail, the warmth, the compassion, how well they actually know you, as opposed to a facility that has only 5 patients per each caregiver. Similarly, you may want to know about the training that individuals on a care team have. Now, I'm not necessarily saying that you want to see well, maybe you do want to see the curriculums, but that might be overwhelming for some of us. However, for example, let's say that you're looking at memory care units and you find out that the staff working in the memory care unit don't have de-escalation training, or they don't have memory care specific training. That might be a red flag. And one way, if you don't want to ask about the specific trainings, you can ask scenarios. So, for example, for memory care, you might say, what would you do if my loved one gets very agitated because they think it's time for them to go to work? How would you handle that situation? If you're speaking to somebody and they don't have the answer to that question, it might indicate that they don't have that training, and it might be a red flag for you. Maybe they only have bathing and ADL type training, but they lack that nuance, and maybe that's a red flag. Understanding staff turnover and whether the facility is fully staffed can also help paint a picture of a lot of things, including the level of care in that environment. As we mentioned earlier, there are staff shortages, unfortunately, but that probably means that if a facility is not short staffed, that it might be a decent facility, right? Are staff smiling, or do they look miserable? How are they interacting with residents? How do the residents seem to feel about the staff? If it's super short staffed and you're seeing that everybody looks miserable, maybe that makes sense because people are spread thin, but also maybe there's a reason that they're not able to hold on to their staff. And those are things you might want to consider. We'll also talk a little bit more about that during our Trust Your Gut segment. And then lastly, knowing who is in the building, especially on weekends and holidays, is important. Will there always be someone there who can assist in an emergency or a medical issue? Is there security on site? What happens when there's an emergency? Is there always somebody there, for example, at the front desk? What if you can't get a hold of your loved one and it's 2 a.m. and there's an emergency? How will you be able to do that? Understanding these things about staff, particularly for your individual needs, can also help you decide on a type of facility or a particular facility that might best suit your needs. Health and safety are often a huge reason that people are considering long-term care in the first place. So it's really important to be as informed as possible on the health and safety of a prospective option. For example, with memory care specifically, a significant difference between memory care and other types of care is a secured entrance. And this is because you want to prevent wandering risk. So if you're looking at somewhere that provides memory care, make sure you ask about security. If the area is locked, are the stairwells also locked within the building? Is someone on site 24/7 in the memory care unit? Regardless of the type of unit, safety and security are still important. So learning about safety features such as Handrails, emergency alerts, and the building safety and security should factor into your considerations regardless of the type of care that you select. And if you are asking these questions on a tour and you're not really getting a thorough response, or the response you're getting seems kind of vague, maybe that's a red flag about that location. When it comes to more intensive types of care, you also want to know how often your loved one will be checked on. For example, will it be every few hours? Will it be a certain number of times per day? And this can help with a lot of things. Was there a fall? Is there a hygiene issue? Making sure that someone will be attentive to your loved one, particularly who has difficulties with ADLs, is something that you're going to want to know about. And a location should be able to give you that information. Additionally, for memory care and dementia care specifically, well, and really for all types of care in all humans, we all have bad days. But for those memory care, dementia specific bad days, it might look a little bit different than, my bad day or your bad day. And it requires extra care. So asking staff how they deal with those issues is a great idea, particularly from a health and safety perspective. So, for example, if your loved one doesn't want to take a shower or get dressed, ask them how they would deal with that situation. It's a very common situation. So if you're at a location and they can't really give you a good answer, or the answer doesn't really sound safe or compassionate, again, maybe that's a yellow or red flag. Now, I've also put location on this list, and that might seem weird on a health and safety list, but it can actually be important. So, for example, if there's a wandering risk and the building is next to a highway, is that a potential health and safety problem for you? If your loved one gets out and the highway is right there, should you be concerned? Additionally, being near non-medical and medical services is worth considering when it comes to health and safety and your location, as well as whether that location is near family and activities that your loved one enjoys, because maintaining mental health is an important piece of health and safety regardless of your age. So if your loved one is going to have to commute an hour to get to their church or their craft group, how is that going to impact their health and safety? Additionally, if that's the case, what does transportation look like? And remember, find out whether it's included in that cost of stay or not. Now we come to both the easiest and the hardest slide, because trusting your gut is a very important piece of evaluating a space, and you really should prioritize those gut feelings, maybe even over some of the things that whoever is taking you on the tour is telling you about a location. Trust your gut when it comes to evaluating a space. And when I think about trusting your gut, it also goes into your 5 senses. So what do you see in this location? Is it clean? Are there activities posted around? Is it kind of doom and gloom? Does it seem, or does it look a little bit dreary, or does it look cheerful and welcoming? Look at the residents. What are they doing? Do they seem clean? Are they all just kind of lined up in a hallway, or are people engaging in activities? Are they interacting with staff? If they are interacting with staff, what do their faces look like? What are their facial expressions? What are those nonverbal communication signals that you're seeing? When it comes to smell, if you smell urine or feces, it might give you pause. It might be a yellow flag, but it might be a red flag if you smell it everywhere. If, it's isolated, it happens. But other than those smells, what else do you smell? Is it pleasant smelling? I'm trying to think of what other smells you might look for. But yeah, because imagine you're being in that facility, you or your loved one, every single day. So how is it going to feel to smell those things every single day? Is it fathomable? Do you hear people laughing and chatting? Is there music? Is it completely silent? Or do you hear people crying out for help? How does what you hear make you feel? Keep those things in mind, because again, more likely than not, this will be the soundtrack that you or your loved one is hearing over time, day in, day out. Touch might seem like an odd sense to list here, but this could mean anything from the comfort of the facilities to whether the walls and doors feel sticky. Just keep in mind, again, all 5 of your senses. And lastly, you can use taste as well. How's the food? Not that you should taste the food on other people's plates, but does their food look tasty? Does it look nutritious? Whether or not you're using these senses or not, thinking about how a space makes you feel is huge and should definitely be taken into account. Do you feel welcomed? Do you feel anxious? Does the space make you feel hopeless or depressed? And maybe you felt anxious before you got to the location, right? I'm a pretty anxious person myself. So I would say after you leave the location, do you feel more or less anxious? How did your mood, how did your affect change from before you got there, while you were there, and after? It's very important to pay attention to these cues. Your body's trying to tell you something about a place that potentially you or your loved one is going to be into for a very long time. Okay, and I just want to sneak in some little miscellaneous or other considerations as well. So, one that might come into play is spirituality and religion. If that's something that is important to you or your loved one, are those services offered on site? Are they able to get to and from those services if they go, for example, to church somewhere else? And remember, I mentioned location before. This might be something you want to think about when it comes to location. On the other hand, maybe you or your loved one really does not want a location that has religious or spiritual aspects to it. So understanding what that looks like in a location might be important. You'll also want to think about the size of community that applies to you or your loved one. Would you like to only have 3 to 4 neighbors, or would you like to live somewhere with perhaps 100 neighbors and lots of activities that you all do together? Do you want a space where you can really kind of be on your own and do your own thing, or do you want a space where there's lots of community, lots of togetherness, lots of common areas? You might also want to think about whether the person on your tour, the person taking you on your tour, I should say, works on commission. And I'm not saying that one or the other is better or worse when it comes to finding long-term care, but if someone is working on commission and it doesn't seem like they're listening to you, or it seems like they're giving you kind of vague, canned responses, that might be cause for concern for you, right? Additionally, you may want to find out whether the option that you've chosen is nonprofit or for profit. There are a lot of different pros and cons to each of them. I'm again not saying that one is better than the other, but it might help you make this decision based on what your needs, your values, and your wants are when it comes to long-term care planning. At this point, we have covered a lot of things that you might want to think about when it comes to making a long-term care placement decision. So many things, a cornucopia of considerations, if you will. And maybe you're feeling overwhelmed by this process, in which case I do not blame you. And if that is how you feel and you're willing to relinquish a little bit of control, a placement agency may be very helpful for you. Usually, this is a free service, and a placement agency in this context will listen to your needs and desires. Sometimes they'll perform their own assessments to make sure that they are finding the appropriate level of care for you, and they'll help you narrow down that list of options with some that they have already vetted and or have relationships with. Now, I'm not saying that they're the panacea necessarily. Some people might really love them, some people might really not. But one thing I will say is if you're deciding to choose a placement agency, just make sure you do a little bit of homework on that agency. We don't often get reports on the Elder Watch helpline related to fraud or scams when it comes to placement agencies, but it's not unheard of that there might be a couple of bad actors in this otherwise very helpful service. So if you decide to do a placement agency, just make sure you look into that agency before you decide to entrust them with helping you with this very difficult decision. You can also get in contact with your local area agency on aging. In Denver, you can call them at 303-480-6700. That's 303-480-6700. The Area Agency on Aging does a lot, but one of the things they do in this context is they provide useful information, referral, and assistance services, as well as options counseling and case management, as well as ombudsman services to people who are in skilled nursing, assisted living, long-term care facilities, but also people who are looking into these services prospectively. So those are two resources to keep in your back pocket if this process seems overwhelming and you want a little bit more help, a little bit more guidance in this journey. That's a wrap. You have now learned some of the many, many, many considerations that go into finding a long-term care placement. As I mentioned before, none of my lists are ever exhaustive, but I hope that they've helped you on your journey to identifying some of the things that you might care about, you might not care about when it comes to finding the appropriate long-term care facility. Next time, we'll talk about insurance, and that's going to be another two-part episode because it's very, very, very complicated. And also because we've talked about 14 options. And so I want to give you insight into how insurance plays into each of the options that I laid out in the options and acronyms presentation. So if you missed that one, that was the first two presentations, and we covered long-term and short-term, as well as lower level of assistance and higher level of assistance options. So next time we'll go into how insurance works when it comes to all of those different options. And then after that, we'll talk about some of the ways that you might be able to pay for things that insurance won't cover. Thank you so much for joining me. My name is Jessica Zawadsky, here for you on behalf of Elder Watch. I'll see you next time and have a great rest of your day. Bye.